September 11th, 2001. The threat of terrorism hits home. Today, we must prepare for the possibility of all kinds of terrorist attacks, including bioterrorism. Terrorists are most likely to strike high visibility targets along major transportation routes. Potential targets within or close to Alameda County include the Bay Bridge, the San Mateo Hayward Bridge, the Oakland Coliseum Complex, Lawrence Livermore National Lab, BART tracks and stations, the Oakland International Airport, and the Port of Oakland. The FBI also cites public buildings, shopping malls, schools, utilities, refineries, and chemical and nuclear research facilities as potential targets. The events of September 11, 2001, followed by the anthrax attacks during fall 2001, have raised awareness of bioterrorist attacks. Since 2002, the Alameda County Public Health Department has been working with city, county, and other stakeholders on plans that will preserve health and prevent the spread of disease. This is referred to as mass prophylaxis. City officials will have the primary responsibility for command and control activities of pods, points of distribution. Alameda County is responsible for the pods located in the unincorporated areas of the county. City and county officials have identified and evaluated pod sites within their jurisdictions. While most cities in Alameda County have 2 to 3 pods within their city limits, some have as many as 9 pods. These planning activities have been in play for some time and will help us prepare for a public health emergency, such as an anthrax event, that will require dispensing or administering protective medications to the public. As a health professional or supporter of the health mission, you may be called on to participate on our team of mass prophylaxis responders. At these medication dispensing sites, or pods, you'll help minimize the ill effects of a public health disaster by providing protective medicines to the public. A swift and aggressive prophylaxis campaign has the potential to save hundreds of thousands of lives. Your role in that, or any public health disaster, is essential. Getting medications to the masses. The job sounds simple enough. The tough part is reaching out to 1.5 million people in just 2 days. Training is an essential component of preparedness and response. Alameda County's ability to respond to a bioterrorism event, major disaster, or public health emergency is dependent upon the knowledge and experience of public health employees and also our community partners, including local hospitals, clinics, schools, community-based organizations, and faith-based organizations throughout the county. Our partners have a wide variety of skills and abilities. A well-trained workforce is basic for a strengthened infrastructure that has the capacity to detect, control, treat, and prevent illness and injury resulting from biological terrorism or other infectious disease outbreaks. Why the rush? If a person is exposed to a deadly biological agent, such as anthrax, plague, or tularemia, they'll have a much better chance of survival if they quickly take a protective medicine before they become symptomatic. If that person seeks treatment after becoming ill, their chances of survival drop significantly. The strategy of providing preventive medication to the exposed but healthy is called post-exposure prophylaxis, or PEP. For PEP to be maximally effective, exposed persons need to be prophylaxed as soon as possible after exposure, as symptoms may begin to appear as early as 24 hours. Simply said, the more people we prophylax in the shortest amount of time, the more lives we potentially save. Let's look at an example. In the event of a large geographical release of weaponized anthrax across the county, we may need to prophylax the entire county population. This is what we call a City Readiness Initiative, or CRI event. To respond to such an event, we must provide oral antibiotic post-exposure prophylaxis to the county population within 48 hours of the decision to do so. In the event of a public health disaster, you will be notified by an automated phone system or phone tree. You may need to listen to the radio or TV for instructions if phones are not working or are unavailable. You may be asked to report immediately to a pod, or you may be requested to stand by. If you're assigned to a pod, wear comfortable clothes and bring your driver's license and work identification card. At the pod, you will sign in and complete an intake registration form. You'll be given a pod role based on your profession and skills. At the pod, you'll be provided PEP for yourself, and if take-home prescriptions are involved, medicine for those living in your household. The PEP campaign may go on for days or weeks. From day 2 forward, you will report directly to your assigned pod. At the pod, the personnel unit leader will review your intake registration form for special skills such as language. Bilingual persons help us to better serve our diverse communities. Pods are generally set up at school gymnasiums and big auditoriums where large numbers of people can easily come and go. To reach out to many people over a short period of time, pods will be open 24 hours a day and staffed in 12-hour shifts. Your mission at a pod is to provide rapid PEP and quality care to our citizens and visitors. Unlike many public health services, this mission will focus on mass care rather than individualized care. Remember, we may need to reach over 1.5 million people in need of protective medicines. Let's take a look at how pods operate. Alameda County Public Health Department uses the Incident Command System in accordance with National Incident Management System requirements. The Alameda County Sheriff and City Police are assigned to security. They'll protect the staff and keep peace inside and outside the pod.